Good afternoon, everyone, or good day, everyone. So for today, we will continue with our discussion with your Cestodes. So this will be the part 2 installment of our discussion lecture for your Cestode. So we will continue this with the cyclophilidian groups, and we will discuss first with your Taenia solium and Taenia saginata. Okay? Please take note here that Taenia solium and Taenia saginata have almost the similar life cycle. Okay, the difference between the two is based on their intermediate host. Please take note that Taenia solium, the intermediate host will be your pigs or your swine, while your Taenia saginata, your intermediate host here will be your cattle or your cow. Okay, how does the infection begins? So please take note that your eggs here, or the gravid proglotids that contains the egg, will be passed into the environment, and that will infect now the cattle or the pig, depending on the species. Okay, when we are referring to Taenia solium, then basically that's going to be for pigs. For cattle, that's going to be for Taenia saginata. Then the eggs now will hatch, no? The oncosphere will hatch, and that will penetrate to the intestinal wall, and it will circulate now to their musculature. What happens now is that it will develop into cysticerci in the muscle. Cysticerci is plural, cysticercus is singular. And again, that will depend now on the animal or the intermediate host. If it's pig, therefore we call that infective stage as Cysticercus cellulosae. If it's cattle, we call that as your Cysticercus bovis. Okay? Once ingested by the human, again, how does the transmission begin? It's because of the ingestion of a contaminated meat. And what is that meat? For Taenia solium, pork meat, or the beef meat for saginata. Okay? Once if eaten, what happens is that your saginata and your solium matures, no, depending on the species again, and they become adult and they pass eggs or gravid proglotids in the environment. Okay, that is now the basic life cycle of your Taenia solium and Taenia saginata. So what is now the common name of your Taenia solium? We call that as your pork tapeworm or the hook tapeworm. And again, what will be the infective stage? Please take note, ingestion of the measly pork. However, you can also be infected by the ingestion of the embryonated egg. If we go back here to the life cycle, again, the main pathogenesis of the disease is brought about by the Cysticercus cellulosae for solium. Okay? This is the part 1 here. The egg is taken by the animal, but you can also get the infection by not just eating the meat, but as well as eating or ingesting the egg or the gravid proglotid. Okay, please take note of that. Embryonated egg. And the infective stage, we call that as the Cysticercus cellulosae. The intermediate host will be the pig or the swine. And again, human here can also be an intermediate host because of the ingestion of the embryonated egg. So let's review again. Humans here can ingest the egg, and the humans now becomes the intermediate host. So therefore, do you think that eggs can develop into adult stage? Not, because we serve as the intermediate host and not the definitive host. Please take note of that, okay? And now take note, the definitive host will be the human. So this is now what we see, the Cysticercus cellulosae. Please take note of the suckers, the invaginated scolex, plus the fluid cavity present here. And you can identify some hooks here, okay? So again, this is now the portion of the hooks here. And then this is now the fluid cavity, plus this is now the suckers, okay? This is basically now your Cysticercus cellulosae, the infective stage of the parasite. Okay? What is the disease that we call for the infection for Taenia solium? We call it teniasis, okay? Teniasis, man is the definitive host because we ingest the Cysticercus cellulosae. However, on the other hand, there is also an infection brought about by the ingestion of the eggs, correct? Once we ingest the eggs here, what is what is now the role of the man in this infection? We call that the man as the intermediate host, okay? And that is now the formation of your cysticercosis. Once we ingest the egg becomes a cysticercus. That's why we call it human cysticercosis. Again, please take note of the difference between tiniasis and human cysticercosis. Tiniasis, man is a definitive host, and what you ingest now is the cooked pork, insufficiently cooked pork that contains in cysticercus cellulosae. Human cysticercosis, man is the intermediate host, and you ingest the egg of Taenia solium. Please take note of that. Now, how do we diagnose? Based on the eggs present, or you can identify that based on the gravid segment. So later on, we will try to differentiate the gravid segment of your Taenia solium and saginata. And what will be our definitive diagnosis is basically examining biopsy material from cysts. Okay, again, what will be now the treatment of choice for this one? Of course, it's praziquantel. Similar with what you had with your trematodes. It's still your praziquantel. In terms of the prevention, please go back again with the life cycle. By knowing the life cycle, you will be able to understand how to prevent the infection. Avoid eating raw pork, proper excreta disposal. Okay, I want you to appreciate this video. Okay, as what you can see here, this is actually your Taenia solium. Okay, this is the adult Taenia solium inside the intestine, and you can identify this as a feces. Okay, the video 2 here, they try to pull out the worm from the mouth of the patient, no? The tapeworm. Imagine that. How long is that? Imagine it can go more than meters. No? They are trying not to break the tapeworm because remember, each of the segment contains now the reproductive organs. So therefore, you can still be able to grow the tapeworm. Okay. So let's proceed now with the next parasite. This is now your Taenia saginata. We call that as the beef tapeworm or the hookless tapeworm. It is basically from the eating of insufficiently cooked beef. And what will be our infective stage? We call that the Cysticercus bovis, from eating insufficiently cooked beef. Our intermediate host here is the cattle, and our definitive host here is human. And we call the infection tiniasis, meaning to say you're able to ingest the Cysticercus bovis. Okay? But take note, no human cysticercosis, meaning to say even if that you ingested the ova or the egg of Taenia saginata, you will never get the infection. You will never get the infection. Again, no human cysticercosis in Taenia saginata, only in Taenia solium. Therefore, here in Taenia saginata, can man become the intermediate host? No. Man is only the definitive host. Okay? Man cannot be an intermediate host because we do not have human cysticercosis here. So it's similar now with Taenia solium, basically on Taenia eggs. You can differentiate one gravid segment, and you can check the biopsy material from the cysts. And again, how can we prevent this one infection? Through praziquantel. Okay, now let's compare the ova of your Taenia eggs. Your Taenia eggs here, as what you can see, it's spherical or subspherical. And you will be able to see this, that this portion now is the oncosphere. This in oncosphere is actually surrounded by a thick embryopore, no? And then you can see the numerous pits here, plus the presence of the hooks, usually 3 pairs of the hooklets, no? You can appreciate here, 1, 2, 3 pairs of your hooklets or the hooks. So please take note that you cannot differentiate the egg of Taenia saginata from Taenia solium. It cannot be, okay? The only thing that we can do, if ever you can detect the Taenia eggs, just put it Taenia eggs, but cannot be Taenia solium or Taenia saginata eggs. You cannot differentiate the two. You need another way to differentiate by means of checking the scolex, by means of checking their a different segment. So we will discuss that in a while. So for the scolex now, how can we differentiate your solium from saginata? Number one, the presence of the hooks. Again, we call taenia solium as your hook tapeworm, while your saginata is the hookless tapeworm because you cannot see any rostellum here, plus there is no hooks. So therefore, it is unarmed. Okay, it is unarmed. But there are four suckers, both of the scolex. And again, you see your taenia solium here, it's more spherical, while your saginata, it's more cuboidal. Again, the most important parameter here is the presence of the rostellum in your solium, but not on the saginata. So again, can you see some rostellum here? You cannot. Therefore, this is taenia saginata. Here you can see the hooks. It's more spherical. Therefore, this is now your taenia solium. Again, saginata, solium. Okay, how about the mature proglottid? One important parameter to differentiate the two is by the presence of their ovary. Because in your taenia solium, you'll be able to see 3 lobes of ovary compared to your saginata, 2 lobes of ovary only. Because your ovary in taenia solium will have an accessory ovarian lobe. Okay? So therefore, it becomes 3. Somehow like this. 1, 2, and a small one here. Okay? 3 lobes. And if you compare here to taenia saginata, only 2 ovaries you can identify. 2 lobes of ovary, 1 and 2. I hope that is clear. Okay? Plus, another important parameter is lesser follicular testis here. Lesser follicular testis, but more follicular testis in your saginata. Okay? How about the gravid proglottid? It's by the number of their lateral branches, no? You can see there are 7 to 14 lateral branches in your taenia solium, but more lateral branches to your taenia saginata, usually 15 to 20 lateral branches. So if you can see this one, you don't need to count anymore. You just see that your saginata here has more lateral branches compared to this portion here, okay? Now, this is just the comparison of what we discussed a while ago. So kindly go over with this table. This is very important for you to understand more the discussion. Okay? Now, let's proceed to the 2 other parasites. We will now discuss your Hymenolepis nana and your Hymenolepis diminuta. Okay, let's check now the life cycle of Hymenolepis nana. Your Hymenolepis nana here, as what you can see, humans and rats can serve as the definitive host. We become infected by ingestion of the insect that contains the cysticercoid larva. Therefore, our infective stage here is the cysticercoid larva. Okay? And once ingested, it matures, the egg becomes an adult until such time that the eggs can be passed now in the feces. And that can be taken now by an arthropod or insect, and the insect becomes the intermediate host. Or that embryonated egg can directly be passed to the human. So therefore, take note that your Hymenolepis nana, it may or may not require an intermediate host. Okay? Because the fact that there could be auto-infection. Again, auto-infection is very possible in your Hymenolepis nana. Okay? This diagram here shows now, this another circle here, shows now the diagram of about the auto-infection because this does not require any presence of your intermediate host. So, what is now the common name of this parasite? We call that your dwarf tapeworm. And again, how can be transmitted? Through the embryonated egg, direct method, or the indirect method through the arthropod or the insect that contains now the cysticercoid larva, which is now the infective stage. Again, may not require an intermediate host. What are an intermediate hosts? Different insects, including your cockroach. Imagine that. Flower beetle, flea rice, dog flea, and even your rat flea. And again, humans and rat is the definitive host. Okay, the usual symptoms here, patient are having a mild abdominal discomfort to just an abdominal pain, nausea, vomiting, diarrhea, or anorexia. So very mild discomfort. And we can diagnose this one through their presence of eggs. So again, treatment of choice, number 10, you don't need to forget this one again. This is now your praziquantel. And again, you can prevent this one based on the life cycle that we discussed a while ago. How about your Hymenelepis diminuta? So as what you can see here, it is still the cysticercoid larva, which will be the definitive host from the insect. Okay? Once ingested here now, it becomes adult and eggs is passed in the feces. And again, that can be passed again to the arthropod intermediate host. And here, what happens here? Taken now by the insect and ingested again by the human. Okay? So, the common name of the parasite, we call that the rat tapeworm. This is actually a parasite of the rats. And again, transmission is the accidental ingestion of insects with the cysticercoid larva. Therefore, the infective stage now is a cysticercoid larva. And remember, it requires an intermediate host. In comparison to Nana that we discussed a while ago, it does not. It may or may not require an intermediate host. What are our intermediate hosts? The different insects here, their definitive host is the rat, and humans only serve as the accidental host. So, usually, similar with your Nana, usually light and asymptomatic, but take note, no auto-infection. Okay? We can diagnose this one by the presence of their eggs. Okay, how can we treat, prevent, the control? Of course, no? By the characteristic features of the physiolex and their segments and the eggs and their fecalis. Again, of course, no treatment of choice that I'm referring here. It's still your praziquantel. Okay, how can we differentiate your H. nana from your H. diminuta? A while ago, we discussed that your saginata and solium, you cannot differentiate the two ova. But for Nana and diminuta, you can differentiate here. How? By the presence of polar filaments. Because your H. nana here, this is now the portion of your oncosphere. This is the oncosphere. You can identify the polar filaments. No? At the pole side, there are polar filaments here. I hope that you can able to appreciate this one. And this portion here. But here, in your H. diminuta, you cannot see any filaments at all. Okay? No polar filaments for Nana. Aside from the polar filaments that is present in your H. nana, your H. diminuta, it's much larger than your H. nana. So again, no? Larger, no polar filaments. Much lower, but there are presence of polar filaments. But it cannot be appreciated here well. Okay? So, how can we compare now the scolex of your Nana from your diminuta? Now, this is the scolex of your Nana. As what you can see here, it has a very prominent rostellum plus the presence of a 20 to 30 Y-shaped hooklets. In comparison to H. diminuta, you can only appreciate the rudimentary rostellum. Okay? But of course, both will have a 4-cup shape like suckers. No? 4-cup shaped suckers. 1, 2, 3, and 4 at the back. 1, 2, 3, and 4 at the back. But here, no? You can clearly appreciate the H. nana rostellum. How about the mature proglotid? How can we differentiate the two? Please take note that each of their segment will contain 3 testes and 1 ovary. How will you be able to differentiate ovary from testes? If you look at this one here, this is 1 ovary, 1, 2, 3 testes. No? The testes is more condensed, while the ovary, it's lighter and less condensed. Okay? So, how can we compare now the Nana versus the diminuta? It's basically on the arrangement of the ovary and testes. If it's more straight pattern, that's gonna be diminuta. If it's disorganized, that's gonna be your H. nana. Less straight pattern. You see, no? It's less less arranged compared here, more organized or more straight pattern. So that's H. diminuta. How about the gravid? The gravid now here, the testes and ovary of your H. nana disappear while uterus hollows out and becomes filled with eggs. Compared now with your diminuta, contains a sac like uterus filled with eggs, disintegrate when separated from the body, then release the eggs. Usually, no, they look the same. But again, this is not the only parameter for us to differentiate your H. nana from diminuta. You can check the eggs, you can check the scolex, and other parameters. You cannot just simply rely on the gravid proglotid. Okay? These are just the summary of the things that we discussed a while ago. So kindly go over to this table. This is very nice table. And again, this is now the summary of what we discussed. Now, for the Raletina garrisoni, the caninum, and your Echinococcus granulosus, this will now be discussed on the next week. Okay? Again, we will only have part 1 and part 2 discussion. The part 3 discussion will be discussed next week. Okay? Thank you, everyone. Have a great day.